내리세레로 바라 예수 반양가지 바노 삼바모 바노 제나 나로 바노 제나 나로 오 바노 제나 나로 반양가지 바노 삼바모 바노 제나 나로 바바 요쿠 파야 파라 구원하지메요 가나이니 모양가지 디노 제나나요 디노 제나나요 디노 제나나로 가나이니 모양가지 디노 제나나요 네네 양마리로 바로 아리샤의 심바 나카라바 요노라 제수 베세 바포네스와 베세 바포네스와 베세 바포네스와 나카라바 바노라 제수 베세 바포네스와 텐디 디노 나위라제 가나 나카타타 만디만디까지 데레라 시포 자완왕게로파 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 만디까지 데레라 시포 자완왕게로파 내구den가 대차이마 게시 심바게우도 구티 게로 파라 제수 다포네스 나론 다포네스 나로 다포네스 나로 구티 게로 파라 제수 다포네스 나로.
Life is designed to be lived to the fullest, celebrated each day and each moment cherished. Welcome to Celebrations Health reBalance, where we celebrate health fully and rebalance health such that one can enjoy optimum health. I am your host, Dr. Hleza, the resident doctor at the Adventist Lifestyle Center and a lifestyle medicine consultant specialist at the Balm of Hope Hospital. And today we are going to delve deeper, as we always do every program that we have every Saturday where we talk more of celebrations. The C standing for choices, E exercise, L liquids, E environment, B belief, R rest, A fresh air, T temperance, I integrity, O optimism, N nutrition, and S social support. And as you can see today, I'm wearing pink simply because it's Pinktober and it's a month where people seriously focus on breast cancer awareness. And I've got some good news that I want to share with you. It is good to wear a pink ribbon. It is good to wear a pink t-shirt or whatever shade of pink or clothing that one can put on so as to just raise more awareness, as the color pink is known to represent breast cancer. But beyond the pink ribbon, beyond the pink t-shirts, beyond the pink balloons, we want to talk about breast cancer risk reduction just in a few minutes before we delve more into celebrations. So we are looking at breast cancer risk reduction, and we've got a few resources that we want to share with you. With the backdrop that 1 in 8 of women in their lifetime can suffer from breast cancer, or you've got a high risk of suffering from breast cancer, and 1 in 1,000 for men. At the same time, when we are looking at risk factors as far as prevention throughout the disease process as far as breast cancer is concerned, to before diagnosis, to treatment, to palliative care, all along the different stages of dealing with breast cancer, there is prevention that can be done, and there is also risk reduction. And the resource that I want to share with you, the first one, is coming from the American College of Lifestyle Medicine. And as you can see on top, it says breast cancer risk reduction. And what they have here is prioritize movement, number 1. Number 2, maintain a healthy body weight. Avoid alcohol. And when it comes to alcohol, we don't even talk about moderate drinking, but total avoidance. For moderate drinking is the school to alcohol dependence and addiction. Then number 4, breastfeed your baby. Number 5, get screened. Of course, the best treatment for breast cancer or any other kind of cancer is prevention and early detection for early treatment. And then it goes on the bottom to say, do you have a strong family history? Be proactive. Know your risk. And I would like to zero in on the right part of the document that says, knowledge isn't power. So knowing that you're supposed to put on pink, whether it's a ribbon, whether it's a t-shirt, that knowledge is not power by itself. To know that there is a high increase as far as breast cancer amongst women in the 21st century, that by itself is not power. But applied knowledge is power, and you want to take control. And this is coming from Eric Thomas. And according to CDC, only 5 to 10% of breast cancers are caused by genetic mutations like BRCA1. But lifestyle can probably contribute more than 58%, sometimes up to 80%, depending on how one is living their lifestyle. So this is the summary as far as American College of Lifestyle Medicine is concerned. Dr. Prince, thank you for coming to the show. Please introduce yourself to our viewers.
Hello, viewers. My name is Dr. Prince Nduva, and I'm a lifestyle medicine consultant. And I'm happy to be here.
Okay, thank you so much. Do you have something you want to share with our viewers as far as breast cancer is concerned? Maybe just in a minute.
Yes, when it comes to breast cancer, it's very important to know and to understand some of the red flags.
Yes.
Because usually we encourage issues relating to self-examination right? Usually, self-examination can be done once or even twice a week, or even every day when you having a shower or wherever. You can just do your self-examination. Then you get also to get an examination from your doctor if you notice some red flags.
Yes.
So I just want to share just a few red flags, especially when you are doing some self-examinations or self-tests. So the first thing that you need to consider to look at is to check if there is any hard lump or hard knot when you are doing your examinations or your test, right? Of course, we are not going to be sharing how we can do our tests, but there's a lot of information on how you can do your tests, right? So if there's a hard lump or a knot on the breast or on both breasts, then there's a call for concern. Then also even a lump under your armpits, it's very important to look for a doctor if you notice that. Then also a swelling or a thickening, right, that doesn't go away, right? It's very, very important to note. Then also a puckering of skin, where the skin of the breast changes its texture and it changes its softness when the skin start to look like an orange peel, right? Then you need to look into that. Then also nipple changes, right, which is inversion, pulling inside. If the nipple start to pull inside, you need to then get further assistance just to make sure everything is okay. Then also nipple discharge, right? So if you're not breastfeeding and you start to realize that there is a discharge on the nipples, then you need to look for help, right, when you start to experience that. Then also it's encouraged to do some self-checks or self-test after a week after your periods, right? Because usually during the time when one is on period, there are some hormonal changes that take place, and also there's a bit of hardness that is found on the breast. So you might end up
a false flag.
So
okay.
we encourage that at least after a week, you then just check is there anything that is happening.
Excellent. Thank you so much. Yeah, so this month of October, we've been going around different companies, even some schools, educating and doing corporate wellness as far as breast cancer is concerned. And something that I also picked is that generally 50% of breast cancer cases, for those that are married or that are sexually active, that have got a partner, it is actually the opposite sex who actually picks it up first before the woman does. Yes, so I would encourage that if you're a man and you're out there and you've got a sexual partner, or you are married, whatever the case might be, please check into how to check for breast cancer as far as the need to visit the doctor is concerned, or a clinic when you notice something that is amiss, whether it's a lump or whatever it can be that you pick that is amiss, so that there's early detection. The last resource that I'm going to share with you is coming from Advent Health. So Advent Health is an institution that encompasses everything about Adventist health. We're talking about different institutions, hospitals, universities, and other institutions of health service provision. And they've got a very beautiful resource that I would encourage you to get. You can get in touch for you to be able to get this resource. The resource is entitled Heal. It's entitled Heal. That is Healthy Eating and Active Lifestyle, a breast cancer guidebook. Okay, Heal. That is Healthy Eating Active Lifestyle, and that is a breast cancer guidebook. So this is a breast cancer program guidebook by Advent Health. And as you open inside, you'll find that this is a very good book. It was put together by Courtney Chappell, a registered nurse practitioner. And I just want to pick on a few things. It has got where it says physical activity for those that are suffering from breast cancer and those want to reduce their risk of breast cancer so that they become aware to be able to make action with the lifestyle medicine. Then it talks about resistance training and gives different types of groups that can be done. And here it talks about mindfulness, simply because people can become challenged in their mind as far as this condition is concerned. The next page talks about nutrition, and here one can write notes. There's a shopping list about different fruits, vegetables, etc. And it goes on where you can write notes, and then it talks about the lifestyle medicine approach to breast cancer, 6 ways to take control of your health, the 6 pillars of lifestyle medicine. And on this one, it has got the Loma Linda University Health Life Assessment short form. So this is quite a comprehensive book. Lifestyle stress reduction, avoidance of risk substances. It talks about plant protein versus animal protein, a whole food plant-based plate. Then it then compares protein sources head to head between different sources, that is animal sources and plant sources. And then one can also write notes. And we utilize this particular booklet for our breast cancer patients and those who just want to reduce the risk for breast cancer. And if you want to have a copy of this booklet, please get in touch with me, Dr. Charles Hleza, on +263 783 809 684. +263 783 809 684. Okay, thank you so much for joining us on this short snippet where we just wanted to bring, this awareness about breast cancer and that there is hope for breast cancer. Beyond the pink t-shirt, beyond the pink ribbon, you can be in charge and be in control. Well, Doc, today we are looking at celebrations.
Yeah.
We're looking at celebrations. And on celebrations, what we really want to do today, we want to zero into the data. The practicality of celebrations from a lifestyle medicine point of view. And what we are looking into today is data that we collected on patients that were suffering from hypertension and diabetes, 47 of them in 2024. And the way we collect this data is through a medical history form. When a patient comes through, this data collection that is done, patient history collection that is related to celebrations, because we believe celebrations plays a very pivotal role as far as prevention of disease throughout the different stages of disease experience, from primary to secondary to tertiary to quaternary. All the way through, celebrations plays an important role. These 13 pillars, which if you put it in clinical practice, we are talking of lifestyle as medicine. That is a lifestyle medicine as a medical specialty. So the parameters, when someone fills in the document, we're looking at exercise over the past 2 weeks. How many days did you exercise? And then on average, how many minutes did that person have? We're looking at sleep. Which of the following did you experience? Difficulty waking up, morning fatigue, etc. We look at mood. And you can see these are principles of celebrations, looking into alcohol use, and the patient get to tick. And the 47 that we're talking about, they were confirmed hypertension and diabetic patients by their doctor. And now they are coming for assistance for better management through lifestyle medicine principles. And then tobacco use is another one. And then lastly, the longest one that we usually look at is apart from the different types of maybe diseases that already have been diagnosed, we look at diet. This is the nutrition part where we're looking at artificial sweeteners. How many did you take on a daily basis or weekly, on occasion, really almost never, frozen or fresh fruit, eggs, fish, processed meat, fast food, caffeine, etc. And this data then gets collected as someone goes through the clinical process where their vitals get checked, their BMI, their weight, their height gets checked, their blood sugar gets checked, and where necessary, blood tests can also be done through different labs of choice, depending whether one is using medical aid or not. And then we feed this into the system, and data is collected. And we want to look at the impact of these letters that we find on celebrations. So maybe we could start looking at choice. What have you find in your practice as far as choice is concerned in relation to disease experience?
Okay, so I've realized that from the confirmed cases that came through to the lifestyle center for better management of their conditions, most of them had different choices with regards to their diet, right?
Okay.
So their diet, usually when it comes to diet, there's knowledge that one has, especially when one comes through and they say, we are already following a certain diet, right? So the first question that we always ask is, what is a good diet to you, and how does a good diet look like, right, in your own understanding?
Yes.
Right. So that's when you get to understand what a diet means to an individual, right? So when it comes to choices, we specifically zero into the diet, right, where we actually see a correlation between the choices in your nutritional life, how you eat, right, in relation to non-communicable diseases,
yes,
especially hypertension and diabetes.
Okay.
Right. So from this data, there's a poor diet, there's a very poor diet, there's a moderately good diet, and then there's good diet.
Okay.
Right. So from the people that came through, right, when it comes to diet, right, from the 47 patients that we saw in 2024, right, we had just one patient who had good diet, right?
Okay, doc.
Yeah.
Wait. So we are talking about choices here.
Yeah.
Choices.
Yeah.
So every day people are faced with choices.
Yes.
It's time to eat breakfast. They're going to make a choice.
Yeah.
Maybe they choose to eat in between meals. They're going to make a choice.
Yeah.
Lunch, make a choice. Supper, make a choice. So we are saying out of the 47 confirmed cases, who actually probably, maybe we could say, they at some point they were told maybe about sodium, salt intake, etc., and other dietary
low fat.
Yes,
stuff,
you know, you are saying out of the 47 that came through, only one.
Yeah, only one.
Out of the 4 parameters, only one had a good diet. As far as choices are concerned.
Yes. Hence, it baffled us, and we were just looking into it. They're saying because when you are talking of the celebrations on its own, right? It was so interesting that the one patient was following a good diet, but when it comes to other forms of so their sleep pattern, their exercises, they were found wanting. Right? So it's something that is connected.
Yes.
You can't say that I'm following this and I'm neglecting this. You might follow the other, and when you neglect the other, you then develop such conditions.
Yeah, you see, I'm really seeing something here. You see, when it comes to celebrations, maybe in the future we can discuss about some of these patients, when then they have got better knowledge and they're making better choices, how did their BP respond?
Yes.
Okay, I'm reminded of a gentleman. This gentleman came to the office, and he is quite in his 60s. This gentleman recently divorced, and of course I'm sharing this with consent. Recently divorced and remarried.
Okay.
Yes, but he's got UTI and high blood pressure. He's got bladder problems, and as far as sexual functionality is concerned, it's compromised. So for him, to keep this newly married woman, he has to be healthy.
Okay.
So for him, the choice to say, I am choosing to visit a lifestyle medicine consultant specialist is because I want to impress in my new marriage.
Okay.
And I want to keep my new marriage. And I also want to have children. And look, this guy is 60. And he's realizing that he's gone to different clinics, and they said to him that at your age, your seed is not as effective to be able to be productive of having children. And yes, through lifestyle medicine, something happened. So you want to stay tuned so that you don't miss out on this one.
Thank you.
Yeah. So that was on choice. Yeah. What about exercise? Have you come across some, especially we want to zero in on the 47, because this is data that was collected. It's not hearsay.
Yeah.
Out of the 47 that came through, for how was their exercise experience? Maybe if you've got also in relation to their BP readings, you could share maybe probably to say maybe for randomly maybe for about maybe 3 or 4 who probably had a good exercise or maybe had moderate exercise. There are also BP readings were at a certain level. Yeah.
Right. So when it comes to exercise, where for the patients that came, 2 patients were highly active in terms of exercise.
2 out of 47.
2 out of 47, right.
We need to up our game, scale up our game for people to realize that just walking,
it's
the impact walking can have.
Exercise,
even swimming, maybe going for maybe basketball, netball, whatever it is, social soccer, or maybe even going to the gym. Yeah, because we're talking 2 out of 47.
2 out of 47.
Yeah.
So 2 of them had about 4-5 times a week.
Wow.
Right. Yeah.
That's impressive, eh?
That's impressive, right? So then 3 patients were exercising 4 times a week.
4 times a week,
which is better. Then the ones that were exercising 3 times per week were 3 patients as well, right? Then who exercised once or twice a week were 9 patients.
Okay.
Yeah, they'll say once, just wake up, chins hot in energy. So it was just once, 9 patients. Then those who didn't exercise at all, right, at all, there were 30 patients.
30 patients out of 47.
Out of 47.
Okay, yeah.
Right. So this is the data that I had. So meaning that for the patients that came through, right, and received help, right, we only had 2 who were highly active, though they were found wanting on diet as well.
Okay,
so their dietary choices were poor, but on exercise they were on point, right? So this brings to picture that all the principles are essential. So you can't say I'm fully committed to this one principle and you neglect the other, right? It maybe just a background as well. On diet, 2 patients were on a moderately good diet.
Okay.
Right? Then those who didn't have information in the context of the lifestyle medicine, what they're supposed to do with their condition, hypertension, diabetes, what they're supposed to eat, those who were actually
ignorant
or blank, there were about 34 patients.
34 patients out of the 47.
Out of the 47, 34, they had poor diet.
Yeah.
Right. So from the data, you could actually see that when they say I daily take of additives, artificial sugars, so those are the foods that they would eat daily. Right. So, and for the ones who had very, very poor diet, right, we had about 10 patients, right? Okay. 10 patients, which is quite good, but 34 of them, these are the people that would say, I know what I'm supposed to do. They will just come and say, when you ask them, are you eating healthy? They say, I'm eating healthy. What are you eating? That's where the problem comes in.
No, that's fine. While you're also getting ready, just to share with us maybe the relation that was there between those probably that were not exercising much, not having a good diet, or maybe having a good diet or exercising, and maybe their initial BP readings, though on medication from their doctor. And of course, just to touch on that one, when it comes to lifestyle medicine, this is a medical specialty. It's not outside of the medical field, and we are also not saying someone should stop their medication. No, they are coming for better management while he's taking their medication. If then it gets to a point where their medication can be tailored down through their doctor, or if they don't have one, through our offices and the doctors that we have, then when we do that, or when I do that, it's only in consent with them and also their doctor, and also with the data that is being given on what needs to be done. So this is the approach that we are discussing here. Right. Now, let's talk about alcohol and tobacco. Let's put the two together. Because mainly alcohol and tobacco usually that's under temperance on celebrations. How did the patients fare as far as intake of alcohol and tobacco?
So for the patients that managed to come through, some of them, when it comes to alcohol intake, about 10 of the patients, right, they were involved in binge drinking. Binge drinking. So these are occasional drinkers who say, I just drink on rare occasions.
But when I drink, I drink.
When I drink,
like a fish.
Exactly. Right. Then about 2 patients that came through, they were involved in smoking. Right. So when it comes to temperance, they were not found wanting when it comes to alcohol and smoking. Usually we are at a level where with the information that people have, right? People actually, let me say this, people do have half-baked information whereby one thinks that if I just binge drink, or if I drink moderately, or if I remove alcohol totally, right, then my BP readings are going to automatically go down. Right? So people, when it comes to alcohol, there's much that has been done, which I appreciate, in educating people on how alcohol affects, how smoking affects individuals, especially when it comes to diabetes. Those who go to diabetes associations, they are being educated on why they are not supposed to take alcohol, or they're not supposed to smoke, right? Which is very good, right? A lot has been done on that. So on our data, a few individuals,
about 12 out of 47.
About 12 out of 47.
Both for tobacco and alcohol use, which is good. You know, I have seen a misnomer it's okay that these days, and I actually appreciate this and encourage it. People now are going for marathons, walkathons, for a small fee to support even breast cancer awareness and all these other awarenesses. But we find that some people can even go for 30 kilometers every day, just running. But they found wanting in many other areas. The diet, sleep patterns, stress management, and this increases their risk of getting certain non-communicable diseases. So the best approach is to be holistic. To balance out everything. That's why we are talking of celebrations, health, rebalance. And I don't know if maybe you've come across it in your practice, but sometimes we come across this where the patient is quick to say, look, I am a moderate drinker, and I only drink red wine.
Yes.
Red wine has got resveratrol that is good for heart health, and I'm only a social drinker, but as we're talking about celebrations, especially on choice, and we then take sometimes blood tests, especially the U&E, and then we can see the EGFR sometimes for such patients may actually begin to show a decline, especially if they have come, maybe now is the second year in checking. Some of them get actually encouraged to say, look, you know what, this is a wake-up call. I need to work on this and make that as a point for them to actually consider stop or avoidance of alcohol completely. Okay, now let's look at the other aspect of sleep. When it comes to sleep patterns for diabetes, both hypertension, we just want to focus on the data and glean a little bit from that. Of the patients that came, we're talking about 47, how were their sleep experience?
All right, so their sleep experience, who would sleep 6 hours or more. Right, with 34 patients.
34 patients.
Which is a very good.
Which is quite good.
Which is quite good. Then those who sleep 5 hours or less, there are 11 patients. Right. So I think in this side of the world, in African countries, right, actually I was talking to another patient yesterday, just checking their sleep patterns. They'll say, doc, each time when it's time to sleep, I sleep.
Okay.
So we actually noticed that about 34 patients, right, they would sleep 6 hours, 7 hours, 8 hours. It's something that is not a problem, right, for some people.
Okay.
Right. Then for few individuals, probably due to some mental issues which are also there in the form where people are facing some mood problems, anxiety disorders and other things, right? Those are the ones that usually get it hard for them to sleep.
Okay.
But if they are just having the physical related issues, most of the patients with hypertension and diabetes don't find it hard to sleep.
That's actually very good, because stress management, which we're going to touch next, is actually one of the key lifestyle factors that people suffering from, especially hypertension, have to look into. So you can choose as a viewer on which side of the statistics do you want to be. Under those who are having adequate sleep and better manage their hypertension, those who are having their diet on the good side, who are exercising throughout the week, maybe 5 days in a week, maybe 30 minutes a day, or to be on the other side of the fence. You may be on the other side of the fence and still not have maybe hypertension or diabetes, or maybe have this condition and still well under control. But you know what? It is even much better for you to start considering living healthier now. You can even begin to see the results immediately.
Sure.
What about stress? So, when it comes to the patients that came through, how many did have distress, or what were the outcomes like?
Right. So when it comes to stress, about fewer individuals, right, they would say they have issues in relation to stress. What they had about 10 of them out of the 47, they had secondary stress, which was mainly coming from the condition that they had. Kuti munhu anotouza kutoti ini nditori diabetes, right, and they are actually facing issues like kutoti vakutoita complications are related to diabetes.
Okay.
Right? So those are some of the things that they would bring forth and say, okay, because of the condition that I have, I'm actually finding it hard, right, to factor it in my life, right? So those are some of the issues they had. But primary stress, where they just have stressors are outside of the condition, right? For the 47 patients, it was actually rare.
Okay.
Right? So most of the individuals, they were found wanting on on their lifestyle generally, right? And others would complain, it's now, I'm now living like I'm someone arimujeri, right? Yeah, because
Okay.
It's something that is common to any individual and diabetes. If you realize from the Diabetic Association, especially of Zimbabwe, there are certain portions of food that they encourage one to take. And for those portions, kuti munhu anga achidya, anotanga kufila kuti, so why is it I'm having this food stuff and it whilst others are eating what they want.
Yeah, okay, yeah.
Yeah, so that's a major contributor of stress, whereby someone will be saying, okay, so this condition is now controlling me. It's now telling me what to do.
Eat, what to do.
But when we then get to discuss and to counsel them, give them counseling. No, it's not about your condition. It's about a change of lifestyle. Any individual can make a conscious decision.
Yes.
In the school, rarama ndichida kudya this, and ndorama ndichito exercise. It's something that you can actually do. And what mostly calms people, right? For the ones that I was talking to, right? For the people that came for consultation, vanga vanenge aine stress due to the condition that they had. Their heart breaks into happiness.
Okay.
When you tell them, Kuti, I'm actually practicing what I'm telling you.
Okay. Okay, no, that's good.
So when you start to tell them, I'm actually eating what I'm asking you to eat. I actually have a regular schedule of eating. I have a regular schedule of sleeping. Then they start to say, okay, Saga, if you are doing it, then I can do it.
You don't have hypertension. You're not a diabetic patient, but you're doing it. And you know, it seems like I'm saying about these misnomers in the society.
Yeah.
Chikafu chevanhu vane diabetes, chikafu chevanhu vane, but it's actually just food that is not labeled for such.
Exactly.
It's just food that one can consume.
Yeah.
Kutodyawo porridge rezviyo makuseni usati waenda kubasa usati wabuda, but you don't have any condition.
Yes. Yeah. So the whole acronym celebrations, it helps in reversing conditions and manage conditions.
Yes.
And it also helps to prevent conditions. So it's in between.
Yeah.
It's in between, and it keeps those who are well, right? And it also makes those who are not well to get better. Right? So it's something that I've actually realized. And there's a question that you actually asked when it comes to encountering patients who drink alcohol, and they actually have a patient that I'm doing like discussions with. So they are actually supporting their position. They are looking for every data
of course.
and information on how a red wine is good for the heart, how alcohol in some studies helps in certain conditions. But the only thing that most people don't know and don't realize is that most information that people are getting, especially from AI, right, to support their position, right, AI doesn't do an examination. It doesn't do like a blood test of you, because it just gives information, general information, right? So if you come to me and say, Inini, I've come to realize that like what you have been resveratrol is good for my cardiovascular conditions, right? It's a study that has been done on a small sect. Small group of people, and it's not a proven study that one can just pick and run about now. And we have got different bodies, right? That's why it's very important when it comes to lifestyle medicine, we tailor make a plan according to your lifestyle.
Definitely.
Right? So
that's the way to go.
Yes, there's no one size fits all. Just to say, okay, so nakanzwa pachirongwa kuti munhu should exercise for about 30 minutes a day, so I'm just doing it. We first have to get information. Do you have any cardiovascular issues?
Yes.
Respiratory issues? What is your BMI like? And how many steps should you take per day if you have to do moderate exercise? And what form of, what is your maximum capacity of the pulse, right? That one has to reach according to your age and everything. So you can't say, I have information about alcohol, right? And in some cases it has been used and brought results. You can't get that information and use it kutoishandisa for your own benefit, because AI and Google doesn't read your medical history.
And of course, you find that on artificial intelligence, the different AI tools that are there, DeepSeek, etc., they also come with a disclaimer. To say that you need to verify the information. Yes. So also, when you're looking at some of those studies, you begin to realize that in actual essence, they're not taking into consideration whether these maybe these people were drinking adequate water, were eating more of fresh fruits and fresh vegetables, were having adequate sleep and were exercising. And probably those could be other parameters that contributed to better heart health outcomes, and not necessarily the red wine. What if probably then we say, let's just give them fresh grapes. And then maybe let's just give them maybe freshly squeezed fresh grape juice, or maybe just a boxed fresh grape juice. What we're going to be the results. So maybe we can now move over to talk about I'm not quite sure if what other parameter do we have there?
All right, so the parameters we have it's the age group, right?
Which we haven't touched.
Age group and the gender.
The gender. So maybe we can just talk about those two put together.
All right. So the age group, it's so interesting that from the cases that we received, we had about people who came with hypertension and diabetes who were from the age of 20. Right, 20 to 70 years. Right. So usually it has been common in the past years that hypertension inozonzi une BP wabatwa iri confirmed wapfuura 40 years. Right.
Maybe late 30s, early 40s, or maybe mid 30s sometimes, but
But it's quite interesting that people, the youth, are even getting hypertension and diabetes as early as 20, 25, 30, right, before the age of 40. Right? It's a shift that is so concerning, especially in our Zimbabwean context, right? And my parameters edu, we had about about 36 patients that had a BMI of more than 24. Right, about 36 patients. Right, about 14 of them had a BMI of less than 24.
Okay.
Right, so meaning that obesity is becoming a major risk factor and a contributing factor to both the type 2 diabetes and these cases were not type 1 diabetes.
Okay.
It was type 2 diabetes.
Yes, thank you for putting that across, because we're just saying diabetes but not indicating which one. Type 2. Yes.
Yeah. So this is
Yes.
type 2 diabetes, confirmed type 2 diabetes and confirmed hypertension. Right. So for the 47 patients, the data is been showing that people are actually getting hypertension from as early as 20 years, right? Which is something that is of concern.
Yeah. So I think there should also be a paradigm shift of thinking. I get invited to many churches and I get overwhelmed with the invitations for health days. I think we have got an upcoming health day on the 22nd of November 2025. I think I've got more than 6 invitations where people are really longing for this balanced approach as far as healthful living is concerned. And I think several times we discuss to find out how are your days, how are my days, so that we can try and see how we can share between ourselves and other groups of health professionals who have got a passion and interest in their profession to share transforming knowledge. But I've noticed something that most churches in the afternoon, they then separate the youth.
Oh, yeah.
They go out to their youth program and then we remain with the adults. But as we are seeing now, the youth also are being affected.
Getting adult diseases.
Yes. So it would be quite good to consider programs for the youth to help them on how to make healthier choices. And if you are a health director out there, you know you've got a health program upcoming, please include the youth in your planning as far as their health is concerned. Because you find that we have also realized that most of the diseases that then come in adulthood, they would actually have started probably in the disease process in their teenagehood. And had they made better choices then, they could have probably delayed the onset and reduced the risk. Now, looking at these parameters, did you get to check the average blood pressure readings? Do you have the data with you?
Yes.
So
for the average blood pressure readings were ranging from 130 to 140.
That is
the highest.
Yes.
130.
The top number.
Right? Which is the systolic.
Okay.
Right. So it was 130. The one that we actually tested, it was as high as 150.
Okay.
Right. Then for the lower number, the diastolic, usually it has been 90 to 110 and above.
Okay.
Right? So those were the numbers, and of course, because of the medication that people they come with HCT, metformin, right? My blood pressure readings pawanuya anenga asiri is high, right? Is the ones munanenga asiri pa medication, but there's a significant decrease, right, of my readings, a blood pressure, then also a blood sugar as well. Significant readings, lower readings. Anotanga kuitika is one start to implement, right, my changes, tailor-made changes. I realize that so the true correct definition of the proper diet in my context, and this is how I'm supposed to live. Usually mnakatanga uta 10-day program yake, we give them a plan according to the data that we have, right? We know so this is you have been taking this per your diet, you've been taking this, so we want to remove A, B, C and D. These are the things that we need to remove, and we want to supplement right, and substitute with A, B, C, and D, right? And most of the people that have got those BPs, of course, just an understanding, when one is on medication ye-BP ukatanga kutaura uchiti BP yenyu iri ku130 yakakwira, people start to wonder, are you really for sure? Because 130, it's not something that is of concern. 130, 128 and so forth, it's not something that is of concern if one is a confirmed condition. But we say it's high because of a chance yekuti munhu, when they start to implement, right, and from the experience that we have, when one starts to implement and start to make changes, their blood pressure inotanga kutodzika zvokuti some of them, they start to be happy and to worry kuti yakuramba ichita sei.
And of course, at those readings, there's also a risk that if someone has got an episode or a trauma in their life or situation in their life, it can escalate to maybe hypertension emergence. And also, should their kidney function change, should their cholesterol change into the negative numbers, then there's a high risk that it can actually get into the levels that actually are not good. Maybe just as we are beginning to conclude, I have noticed, because we're talking about lifestyle, when we are looking at adherence to medication, that's part of lifestyle.
Yes.
To say, I'm going to take my medication regularly. I am not going to titrate or change my medication by myself. How has been the experience? I've seen that when it comes to hypertension, maybe diabetes a little bit, there's a certain slackening that people have generally around taking medication. What has been your observation?
Right, so my observation, like a recent patient that came, they called and said, "Doc, I've reduced my medication. My BP has been increasing." Then I said, right? Then I said, "No, please check your blood pressure," right? So I gave them a period of checking their blood pressure, morning and evening. Then I told them to document, right? Then I asked them to go to their doctor and present how the BP he has been behaving, especially after the 10-day program where one starts to implement these changes, right? So I then asked them, please just present to them, to your doctor, and tell him what you have been doing, right? So that they can actually see if there's a possibility of scaling down your medication. So when it comes to that, it's something that is practical, right? And it's something that that actually happens. Kutoti munhu paanotanga kutoita changes, right? The body starts to adjust naturally. Start to adjust. Your BP begin to drop, and most people get so excited such that they want to take control of what they have been doing.
In actual essence, I have noticed that some of the patients who come through, even before they start lifestyle modification, there is a tendency not to adhere to their prescribed medication. And that's part of lifestyle. And my encouragement is stick to your prescribed medication. If you did not self-prescribe, which is, we also discourage that, so you shouldn't self-de-prescribe. Of course, in lifestyle medicine, we have got a de-prescription protocol that is there, that is approved by CDC, that is also has been brought through by the International Body of Lifestyle Medicine through the American College of Lifestyle Medicine, which also comes together with all these other tools that we use, like the diet tracker, etc., to be able to determine the nutrient intake of a patient. So I would encourage that stick to the medication that's been prescribed, and if you're going to see a qualified lifestyle medicine consultant specialist as you're going through with them, as you are taking, you are making the different changes, adhere to your medication until a time when your doctor or maybe the lifestyle medicine specialist that you're working with, if they've got the capacity to tailor down or titrate your medication, then that be done. And I'm also very glad to learn that at your clinic, you also have got a medical doctor that you work with.
Yeah.
That is very key. Maybe just so that the viewers know what kind of work you do, where you are located, so that they can know where to get in touch with you. Just give us that.
Okay.
Yes.
So from the data that I've been presenting is the data that we collected at our clinic in Newlands. It's a lifestyle medicine clinic. It's called Ready Remedies, a lifestyle clinic. So we started operating in 2021, right? And from 2021, God has been graciously blessing us with good results.
Yes.
And people have got a lot of experiences and testimonies from the work that we have been doing and from the changes that they have been implementing in their homes. And also, we work with a medical doctor who is there, and the medical doctor happens to be my wife as well.
And of course, congratulations, Doc. I know you recently got married.
Thank you so much.
Yes,
Thank you so
congratulations.
much.
Yeah.
So we work hand in hand just to give a proper outcome.
Yes,
right?
yes,
Because ultimately we want the best for the patients.
Yes.
Right? So it's not something that is done out of a haphazard work. It's something that is the work that is done with careful consideration,
skillful and professional. Yes, professionalism. Yes.
So we are at number 2 Princess Drive in Newlands, where the Odd Division offices are.
Okay.
Yeah.
No, thank you so much, Doc.
Right.
What are your last words to the viewers?
So my last words is there's still hope, right? There's still hope, and when you implement these changes, not only does it lessen, right, the complications. At times, we are not actually advocating and saying that when you start to implement this, your diabetes is going to go to zero, your hypertension is going to go to zero. It might happen that you might continue to have your diabetes, or the complications, right, or the damage that those conditions have made may be permanent, right? But when you start to implement these principles and the changes and use it in your life, you end up reducing further complication. And you end up also getting a better and quality life, right, with your condition.
Okay.
Of course, for some patients, their conditions reverse, and for some, their conditions are managed, right? And ultimately, it is because of God's will, right? We just do our part, and God does the rest.
Amen. Thank you so much for that. Celebrations, health, rebalance, where we celebrate health fully, and we rebalance health so that one can live an optimum life as far as their health is concerned. Now, back to the testimony. These gentlemen decided to make the right choices as far as diet is concerned, as far as exercise is concerned, as far as temperance is concerned, as far as belief is concerned. Because when these people come into the office for consultation, I pray with them in the beginning if they want. I pray with them at the end, and I encourage them to begin to meditate, to pray, and to study the Bible. And they begin to have a thrilling God awareness. And after almost a month plus, this gentleman, the UTI was gone. And the bladder challenges was gone. The incontinence was gone. And of course, his seed when he's intimate had improved. And of course, we're giving him about up to 3 months so that he goes back for another test. But already you can see improvement as far as the quality of the semen and that is coming out when he's intimate with the wife. So this is something that you really want to consider as far as lifestyle change is concerned. You want to begin to implement celebrations, one choice at a time. Until next time, go ahead and implement something that you have learned today that you have not been doing in the past. And drop a comment for us and have a discussion about your experience. Go to Mandara SDA Church, and like the page on Facebook, on YouTube, share with your friends, drop a comment for us, and let's get the conversation going. The new normal is living healthy lifestyle, celebrations, health, rebalance. Doc, can you please pray for us?
Oh, sure. Let's pray. Dear God in heaven, we thank you for your love. We thank you for your care. And we thank you that you are concerned about our health. Our greatest desire is that may you open our mind and may you open our eyes as well, so that you get to realize that you are even closer to us, and your desire is for us to be in good health. As a people, as you continue to implement these principles that we've been discussing, and as we start to see some positive changes, our ultimate aim and desire is for us to have an understanding that it has been you who has been leading us through all the way. We thank you, dear Lord, for hearing our prayer, and we ask that may you continue to lead and guide us. In Jesus' name we pray. Amen.
Amen.
Ndinoda kutaura kuti ndaponeswa ngero paro, pamsana popemudza wake ndichagara kumushako. Ndaponeswa ngero parake renyenye, ndaponeswa sendichiri mwana wake. Ndinofara ngekuti Jesu auya kundiponesa, ngekuti kupenya kwakeko kuri kunditungamira. Ndaponeswa ngero parake renyenye, ndaponeswa sendichiri mwana wake. Ndinotondera muponesi, ndichiri kufunga ndiye, ndiri kuimba nguva dzese ngerudo rukuru rwake. Ndaponeswa ngero parake renyenye, ndaponeswa sendichiri mwana wake. Ndichamuona mambo wangu, ndoita mutemo wake, achiri kunditungamira, dakara kumusha kwake. Ndaponeswa ngero parake renyenye, ndaponeswa sendichiri mwana wake. Chiripo chiremba kudenga, chinondimirira ini, tichaenda ngekukasika kumusha wake watenzi. Ndaponeswa ngero parake renyenye, ndaponeswa sendichiri mwana wake. Ndaponeswa ngero parake renyenye, ndaponeswa sendichiri